NCSB NCLEX Test Bank 800 questions newest with detailed answers. Question 1. What is involuntary muscular activity around the mouth? Option A, dyskinesia. Option B, akathisia. Option C, echopraxia. Option D, echolalia. The correct answer is option A, dyskinesia. Dyskinesia refers to repetitive involuntary movements like facial tics. Question 2. Which statement is an example of adaptive suppression? Option A, I failed because the boss dislikes me. Option B, I put off the biopsy until after the wedding. Option C, I cannot clean my sunroom. Option D, I will talk to my husband later. The correct answer is option D, I will talk to my husband later. Adaptive suppression involves delaying a difficult task until an appropriate time to ensure better concentration and focus. Question 3. What is the best technique for interviewing suspected child abuse? Option A, be direct and attentive. Option B, approach an ER to clear the air. Option C, ask what they could have done differently. Option D, call services immediately after interview. The correct answer is option A, be direct and attentive. Professional attentive interviewing establishes the necessary trust for accurate assessment. Question 4. What is a nursing diagnosis for a family where parents use severe discipline? Option A, fear of father. Option B, actual injury. Option C, ineffective coping. Option D, altered family process. The correct answer is option D, altered family process. Altered family process is appropriate when disciplinary methods are excessive and abusive. Question 5. What is the highest priority when assessing a spousal abuse victim? Option A, anxiety level. Option B, abuse history. Option C, suicide potential. Option D, drug use. The correct answer is option C, suicide potential. The high potential for suicide among domestic abuse victims makes assessment of self-harm the highest priority. Question 6. What should the nurse instruct a rape victim to do? Option A, do not wash or change clothes. Option B, bring insurance info. Option C, wait for rape counselor. Option D, never leave victim alone. The correct answer is option A, do not wash or change clothes. Preservation of forensic evidence is vital and requires the victim to avoid washing or changing. Question 7. A client discusses events but not feelings about her bulimia. What is this? Option A, dissociation. Option B, intellectualization. Option C, rationalization. Option D, displacement. The correct answer is option B, intellectualization. Intellectualization focuses on logical discussion while ignoring the associated emotional pain. Question 8. What is the nursing intervention for a pacing client? Option A, ask to sit. Option B, help recognize anxiety. Option C, walk with him. Option D, increase supervision. The correct answer is option C, walk with him. Walking with a pacing client allows for the expression of energy and demonstrates therapeutic support. Question 9. What indicates success in desensitization therapy? Option A, replacing anxiety with relaxation. Option B, no anxiety at a concert. Option C, stating no fear. Option D, taking a job in the dark. The correct answer is option A, replacing anxiety with relaxation. The ability to replace an anxiety response with a relaxation response indicates successful desensitization. Question 10. What is the best way to handle a family request for a religious ceremony for the deceased? Option A, cite hospital policy. Option B, refuse to leave the room. Option C, insist on attending. Option D, respect the family wishes. The correct answer is option D, respect the family wishes. Respecting family rituals and grieving customs is essential to culturally competent care. Question 11. What is the teaching for lithium? Option A, limit salt. Option B, take on empty stomach. Option C, withhold if vomiting occurs. Option D, avoid aspirin. The correct answer is option C, withhold if vomiting occurs. Dehydration from vomiting increases lithium blood levels and risks toxicity, requiring that the dose be held. Question 12. What do involuntary tongue and finger movements indicate in an Alzheimer client? Option A, tardive dyskinesia. Option B, Parkinsonism. Option C, advanced dementia. Option D, you need to change drug. The correct answer is option A, tardive dyskinesia. These movements are hallmarks of tardive dyskinesia, a side effect of antipsychotic medication. Question 13. What is a realistic outcome for a cocaine-addicted client? Option A, attend group sessions. Option B, list activities. Option C, meet with family. Option D, deal with feelings in group. The correct answer is option D, deal with feelings in group. Dealt with feelings in group therapy reflects an internal change rather than just attendance. Question 14. What does a client understand about nitroglycerin? Option A, contact doctor for headache. Option B, keep in refrigerator. Option C, contact doctor after 3 doses. Option D, take with water. The correct answer is option C, contact doctor after 3 doses. Nitroglycerin not relieving pain after 3 doses warrants immediate medical intervention. Question 15. What is the priority for a renal failure client with elevated potassium? Option A, the assess level of consciousness. Option B, check EKG. Option C, measure output. Option D, review history. The correct answer is option B, check EKG. An EKG is essential to detect cardiac changes associated with hyperkalemia. Question 16. What is normal in a Parkinson client? Option A, muscle flaccidity. Option B, pill rolling movements. Option C, twitching. Option D, joint pain. The correct answer is option B, pill rolling movements. Pill rolling tremors are a primary clinical manifestation of Parkinson disease. Question 17. What is the advice for an HIV-positive client wanting to donate blood? Option A, at risk so do not donate. Option B, tests are 100% effective. Option C, antibodies take time to develop. Option D, the information is made public. The correct answer is option C, antibodies take time to develop. There is a window period for antibody development, so those at risk should never donate blood. Question 18. What is the correct way to administer antiemetics for chemotherapy? Option A, only after nausea occurs. Option B, prophylactically around the clock. Option C, one at a time. Option D, intermittently. The correct answer is option B, prophylactically around the clock. Prophylactic around the clock administration is the gold standard to prevent chemotherapy-induced nausea. Question 19. What symptom is of most concern for a chemotherapy client? Option A, normal respirations. Option B, a pulsati. Option C, muscle aches. Option D, sore throat. The correct answer is option D, sore throat. A sore throat in a neutropenic client suggests infection, which is a life-threatening emergency. Question 20. What is a concern post-hysterectomy on day 1? Option A, tearfulness. Option B, a temperature 102. Option C, no bowel sounds. Option D, urine output of 200 milliliters. The correct answer is option B, temperature 102. A temperature of 102 indicates infection requiring immediate medical follow-up. Question 21. What is the skincare for a radiation therapy client? Option A, clean with soap. Option B, apply medicated ointment. Option C, wear tight clothing. Option D, avoid sunlight. The correct answer is option D, avoid sunlight. Radiation-treated skin is sensitive and should be protected from sun damage and irritation. Question 22. What indicates effective fluid resuscitation in a burn client? Option A, weight gain. Option B, urine equal to intake. Option C, urine output greater than 35 milliliters. Option D, a blood pressure 94/62. The correct answer is option C, urine output greater than 35 milliliters. A urine output greater than 35 milliliters per hour indicates adequate perfusion and hydration. Question 23. What is the key teaching for a client with sickle cell anemia? Option A, monitor stools. Option B, large fluid intake. Option C, safe flying. Option D, genetic counseling. The correct answer is option B, large fluid intake. Maintaining high fluid intake is the most effective way to prevent the sickling process. Question 24. What is the advantage of hemodialysis over peritoneal dialysis? Option A, faster. Option B, a slower. Option C, less complications. Option D, a nurse administered. The correct answer is option A, faster. Hemodialysis is significantly faster and more efficient at clearing blood toxins than peritoneal dialysis. Question 25. How do you ensure patency of an internal vascular access device? Option A, check for leakage. Option B, check for bruit. Option C, check for bruising. Option D, check color. The correct answer is option B, check for bruit. A palpable or auscultated bruit confirms that blood is flowing freely through the access device. Question 26. Why is peritoneal dialysate warmed? Option A, temperature maintenance. Option B, dilate blood vessels. Option C, prevent infection. Option D, relax abdominal muscles. The correct answer is option B, dilate blood vessels. Warming the fluid dilates the peritoneal blood vessels and enhances the dialysing process. Question 27. What indicates a pneumothorax? Option A, crackles. Option B, bradypnea. Option C, sharp pain. Option D, increased breath sounds. The correct answer is option C, sharp pain. Pneumothorax symptoms include sudden sharp pain on the affected side and shortness of breath. Question 28. What is the priority for a chest tube pulled from the pleural space? Option A, cough. Option B, replace tube. Option C, apply petrolatum dressing. Option D, auscultate. The correct answer is option C, apply petrolatum dressing. An occlusive dressing prevents air from rushing into the chest while waiting for medical intervention. Question 29. What are indicators of worsening heart failure? Option A, leg pain. Option B, thirst. Option C, a drowsiness. Option D, weight gain and edema. The correct answer is option D, weight gain and edema. Weight gain and peripheral edema signify fluid retention and worsening cardiac status. Question 30. What is the purpose of a Holter monitor? Option A, bathing. Option B, record muscle damage. Option C, correlate ECG with activity. Option D, check chest pain. The correct answer is option C, correlate ECG with activity. The Holter monitor allows the physician to correlate heart rhythms with specific daily activities. Question 31. How to prevent thrombophlebitis in a bed-bound client? Option A, dangle legs. Option B, massage calves. Option C, limit movement. Option D, tighten and relax leg muscles. The correct answer is option D, tighten and relax leg muscles. Isometric exercises and muscle contraction increase circulation and venous return. Question 32. What is contraindicated after a total hip arthroplasty? Option A, exercises. Option B, crossing legs. Option C, checking neurovascular status. Option D, a trochanter roll. The correct answer is option B, crossing legs. Crossing the legs puts excessive pressure on the hip joint and increases risk of dislocation. Question 33. What diet is appropriate for diverticulosis? Option A, high fiber. Option B, low residue. Option C, minimal fluids. Option D, no modification. The correct answer is option A, High fiber. A high fiber diet increases bulk and decreases pressure within the colon, preventing diverticulitis. Question 34. What is the priority intervention for a newborn infant to conserve heat? Option A, radiant warmer. Option B, a dry with blankets. Option C, place to breast. Option D, a heated pad. The correct answer is option C, place to breast. Skin-to-skin contact at the breast is the most effective natural way to maintain newborn temperature. Question 35. Where is the fundus immediately following a vaginal delivery? Option A, at umbilicus. Option B, at symphysis pubis. Option C, midway between umbilicus and xiphoid. Option D, midway between umbilicus and symphysis pubis. The correct answer is option D, midway between umbilicus and symphysis pubis. Immediately post-delivery, the uterus is firm and located between the umbilicus and the symphysis pubis. Question 36. What is the definition of the latent phase of labor? Option A, a dilatation of 0 to 3 centimeters. Option B, a dilatation of 4 to 7 centimeters. Option C, dilatation of 7 to 10 centimeters. Option D, a full cervical dilatation. The correct answer is option A, dilatation of 0 to 3 centimeters. The latent phase is the early stage of labor encompassing dilatation from 0 to 3 centimeters. Question 37. What is the first action for a mother with blood pressure drop after epidural? Option A, call physician. Option B, change to left side. Option C, increase oxytocin. Option D, increase 4 fluids and oxygen. The correct answer is option D, increase 4 fluids and oxygen. Left side positioning combined with 4 fluids and oxygen effectively raises blood pressure and restores placental perfusion. Question 38. How is a pregnancy for a woman with 2 births after 20 weeks recorded? Option A, 20200. Option B, 22022. Option C, 30110. Option D, 21100. The correct answer is option A, 20200. Total pregnancies is 2 deliveries after 20 weeks. The code structure is GP. Question 39. What is the delivery date for a LMP of February 16? Option A, November 23. Option B, December 26. Option C, September 14. Option D, December 9. The correct answer is option A, November 23. Add 7 days to February 16 gives February 23. Subtract 3 months to get November 23. Question 40. What should the nurse initially suggest for breast engorgement? Option A, take ibuprofen. Option B, breastfeed more often. Option C, apply ice. Option D, take a warm shower. The correct answer is option C, apply ice. Ice packs reduce inflammation and milk flow, which is the appropriate mechanical treatment for breast engorgement. Question 41. Which document is the legal standard of practice for nurses? Option A, State Nursing Practice Act. Option B, OHAN Standards. Option C, ANA Standards. Option D, ICN Code. The correct answer is option A, State Nursing Practice Act. The State Nursing Practice Act holds the force of law and defines the scope of professional nursing practice. Question 42. What is the primary refractive error characterized by difficulty seeing distant objects? Option A, astigmatism. Option B, hyperopia. Option C, myopia. Option D, amblyopia. The correct answer is option C, myopia. Myopia is nearsightedness where objects at a distance are difficult to see clearly. Question 43. A teenager has coughing, chest tightness, and wheezing. What should the nurse suspect? Option A, tension pneumothorax. Option B, asthma attack. Option C, pneumonia. Option D, pulmonary embolus. The correct answer is option B, asthma attack. Asthma involves airway obstruction from bronchospasm and mucus production causing wheezing and dyspnea. Question 44. Which vitamin is most essential for tissue healing in a postoperative client? Option A, a vitamin C. Option B, a vitamin B1. Option C, a vitamin D. Option D, a vitamin A. The correct answer is option A, vitamin C. Vitamin C is essential for collagen formation and wound healing following surgery. Question 45. Which meal choice is richest in vitamin C for a postoperative client? Option A, liver and rice. Option B, fish and carrots. Option C, roast chicken and gelatin. Option D, a chicken breast and orange slices. The correct answer is option D, chicken breast and orange slices. Orange slices are a high source of vitamin C, which is critical for tissue repair.